Sorry, I haven't seen you for a while, but yeah, it's been kind of a busy week. And yeah, let's talk about vitamin D because the importance of vitamin D in controlling mast cell activation syndrome is beyond huge. So it's mostly known as the sunshine vitamin. Vitamin D is an essential liver egg yolks because it's not widely available in food. The body has the incredible ability to synthesize the vitamin for itself. So, when uncovered skin exposed to UVB rays from sunlight, it triggers the conversion of a specific type of cholesterol to vitamin D. So, humans are designed to thrive on sunlight, which is a special link we share with the natural world. Unfortunately, the impressive natural ability is hampered by a number of factors, including weather, geographic location. Adequate vitamin D is essential for the absorption of calcium, healthy nerve and muscle signaling, as well as immune function, plus so much more. When vitamin D levels are chronically low, deficiency symptoms develop, including weakness, mood changes, chronic infections, and so on. If deficiency becomes severe, bone disorders such as rickets, osteoporosis might develop. Thankfully, bone deformities from rickets are uncommon in developed countries, but we have an epidemic of low vitamin D also because of the gallbladder, especially for women. We need the gallbladder to be able to process all the lipid vitamins, A, K, E, D. So, as your gallbladder, especially with estrogen dominance and all these problems, becomes clogged with stones or sludge, problems develop. So, it's important to understand. Vitamin D and mast cell activation syndrome, no? The main pathway with which vitamin D functions is through interaction with vitamin D receptors, BDRs. BDRs are located in almost every tissue of the body. So when vitamin D binds to BDR, if not thousands of body functions, from encouraging the absorption of calcium to promoting the development of immune cells, vitamin D has a wide range effect depending on the type of cells it binds with. So mast cells contain BDRs and are therefore responsive to vitamin D. When vitamin D binds to BDR on mast cells, it signals the cells to decrease the production of pro-inflammatory mediators. Stable mast cells, making them less reactive to common triggers. So for people with mast cell activation syndrome, the stabilizing influence of vitamin D is essential. While it's difficult in many cases to determine the exact cause of mast cell activation syndrome, vitamin D deficiency plays a huge role. Without the soothing signals from vitamin D to calm mediator production, mast cells are vulnerable to inappropriate activation and chronic release of inflammatory allergic mediators. The action of vitamin D on mast cells provides another avenue from the effective treatment of mast cell activation syndrome, which I find hopeful for many people dealing with this syndrome. When we dive deep into what is really happening in the body, there is much we can do to rebalance and restore the mast cells to their stable state. And vitamin D is the yeah. So let's talk. Historically, the most obvious signs of vitamin D deficiency were rickets or deformity in bones. But prevention is important. The truth is, it develops in extreme deficiency, let's say. So the body produces a wide variety of immune cells, each with its own unique function. Most type of immune cells contain, again, vitamin D receptors. So, vitamin D is essential to balance the immune system, causing the release of more anti-inflammatory mediators and fewer pro-inflammatory mediators. When you have enough vitamin D, the immune system is primed to provide superior protection against infections and inflammatory responses. So conversely, low levels might contribute to chronic and acute infections. So the question of how vitamin D influences inflammatory and immune responses and how altered inflammatory immune responses might interfere with vitamin D. So the chronic infections, such as those in like Lyme disease, for instance, might disrupt normal vitamin D metabolism. Even with enough vitamin D, the body might not metabolize it to use it. So, at the end of the day, you end up having no vitamin D anyway useful, right? So, what happens when patients get trapped in a cycle of too little vitamin D to support a healthy immune function along poor immune function, preventing vitamin D from working? This is a prime example of the complexity of the patients that have one condition can build the next, creating like cycles, because all these are cycles of inflammation, cycles of, things that are trying to compensate so your body goes back to equilibrium. And that's exactly what we need, right? Equilibrium. So, whether you have Lyme underneath, an immune system basically that failed, which is what Lyme disease is, flaring all these infections and, flaring the mast cells and all these combos, which again are loops feeding on each other. We need to stop the loop somewhere. And many times, things like helping your gallbladder and making all the systems go back to normal and equilibrium is what we need. Sometimes as well, we need to put, like, we're really bad, we might not be able to be in the sun that much, but when we can, absorb it but not metabolize it and use it properly. Many times the gallbladder has a lot to do with this as well, especially in women with estrogen and so on. So yeah, be in the sun. That's how important it is. And then, slowly is like, you have a huge puzzle and you have to very slowly pull all the threads so everything slowly and the terrain gets back into equilibrium. And this is a huge one. So again, thanks for watching. Be in the sun, love the sun. I'll see you next time.